Time now is 8:13, and Jeff's been talking about maybe a pretty nice day on Sunday, which means a lot of folks out there might be dusting off that tennis racket and saying, you know what, time to get going. But according to orthopedic surgeon Jon Hyman, you need to be really careful not to injure yourself out there on the courts. And the doctor is with us this morning to talk about those tennis injuries and how we can avoid them and prevent them. Good morning.
Good morning.
So when we talk about tennis injuries, I think the biggest issue for a lot of people might be overuse.
That's right.
Of the same muscles.
Right. At this time of the year, a lot of people are getting involved in the Alta leagues, the USTA, K-Swiss leagues, and so they're playing multiple times a week and maybe have not had the conditioning and the proper warm-up to prepare for this intense season. And so tennis often brings a lot of overuse injuries to the body.
So when we talk about that, you're talking about what things? Can you run them down for us? Tennis elbow perhaps is one?
Yes, tennis elbow is the most common. That's commonly seen when people are gripping a racket.
Right.
And I won't hit you with this, but in the gripping process on the outside of the elbow, that puts a lot of strain on the tendons there. So repetitive gripping and backhand, forehand causes a lot of tennis strain on the elbow, but also the shoulder from a lot of the overhead serving activities. And lower extremity injuries are common too, knees and ankles and things in that nature.
Can you think that tennis isn't going to cause some of those traumatic injuries which we sometimes see in other sports, but it can?
Absolutely. We see severe ankle injuries and some severe knee injuries as well from the rapid acceleration and deceleration. Sometimes people dislocate their joints entirely and require surgical reconstruction. So it's important to be careful about the surfaces that you're on, whether there's debris or how clean it is or there's potholes, because some courts aren't as in good a condition as others, obviously.
Hopefully they will be as spring kind of rolls in and the tennis season gets into full gear. But when you talk about treating some of these injuries, which I'm sure you see a lot of, what's the treatment plan out there?
Well, first thing is to rest and increase the time between your episodes of exposure to the game. Anti-inflammatories, ice initially for the first 3 days, or sometimes heat if you're having an area that's sore. But if it lasts for more than a week or two at a low level, you may want to consider getting a medical evaluation, because one of the things that happens a lot is bursitis in the shoulder.
Okay.
And bursitis occurs between the tendons and the bone in that space. But if it gets worse, it can go down deeper into the tendon and become tendinitis. And that kind of problem is sometimes difficult to treat on your own. Hey,
Dr. Hyman, before we even get to perhaps being injured, are there things that we can do to prevent those injuries in the first place?
Yes, absolutely. One is giving yourself time to build up into proper conditioning for your sport, and also adequate hydration, and most importantly is stretching and warming up. As we get older, we need to take a little bit more time before we play to get our body ready to get out there and have fun.
Tell me about it. Because when we see people like Serena Williams out there and Venus Williams out there, and I think, man, how do they keep from getting some of these injuries?
Exactly. Professional athletes are obviously highly conditioned.
Sure.
They've been doing it for a long time, and their body takes time to adapt to that level of intensity. But for the rest of us, we have to be a little bit more gradual.
Plus, we're not 20-something anymore, are we?
Exactly.
Okay.
Exactly.
Thank you, Dr. Hyman. Appreciate it.
Thank you. I appreciate it.
All right. We'll see you next time around.